All right, so I'm here in Lubbock with Dr. Ben Edwards, and Dr. Edwards is the founder of the Veritas Medical Clinic, which is located here in Lubbock. And actually, Dr. Ben is my doctor now, and I'm just the type of patient that you want to have, one that you never have to see, right? So, taking care of myself, but it's been a short evolution, but a very almost mind-boggling evolution from when I first met you. So let's kind of take people through that, how you got affiliated with me, so through your PA and that type of thing, and bring us up to speed now and let us know what you're doing.
Right, so that was probably 2011, I believe, when my nurse practitioner, Shane Frankel, in Post, Texas, Garza County Health Clinic, where I'd been for 7 years or so. That was my first job out of medical school. And Shane was my nurse prac. He had celiac disease. He was eating gluten-free and managing his disease, as we're taught in med school to do, manage disease. So he was doing that. He and his wife went one weekend to a bed and breakfast up in Amarillo. As I recall, he told the bed and breakfast lady he needed a gluten-free pancake because he has celiac, and the bed and breakfast gal said, okay, we can do that for you, but there's a doctor here that could help you with that. Of course, Shane thought, there's nothing to do for this. You just eat gluten-free. But I think the lady persisted to the point of kind of annoying Shane, so I think I'd get you to shut up. Let me talk to this dude. And the dude was Roby Mitchell, and Roby went on to teach my nurse practitioner really the foundation of health and how the body works, these natural laws God put into the earth that govern the physical body. So Shane implemented those things. He got better. His energy got better. He lost weight. His complexion cleared up. His brain fog cleared up. Not only his gut symptoms improved, but his whole body health improved. So Shane came and told me that he was well, and I didn't believe him. So he ate a bunch of tortillas to prove it didn't just cause him to go into bloody diarrhea from celiac. So I felt morally obligated to find out what he did. For my next celiac patient, I felt like I couldn't just say eat gluten-free. That's one option. But option 2 is do what Shane did, and maybe you could get better too, all the way better. So that moral obligation kicked in, and called Roby and quizzed him on who the heck he was, what was he doing, and that went back and forth for a while.
So initially you sent me patients that you couldn't get well. So one I remember was prostatitis, right? That recurrent prostatitis.
Yeah. Well, we went back and forth on the phone a little bit, and I was a busy guy, 40 patients a day. I don't have time for this. Can't you just summarize this holistic alternative stuff in like one book or something? And I was kind of being belligerent, so you finally said, just send me your 10 sickest patients.
Right.
The worst of the worst that no one could help, that have been to all the specialists. And one was a recurrent prostatitis, infection of the prostate gland. We gave him an antibiotic. He got a little better, but then it came back. Gave him another antibiotic, got better, came back. Gave him a longer course of antibiotic. Gave him 2 antibiotics. Sent him to the urologist. They gave him an antibiotic. So this was over many, many months. And so we sent him to you, and he got better relatively quickly and stayed better. And of course, we were chasing bacteria with antibiotics, but we forgot about the fungal component, and no one had addressed the fungal component. That was the core issue with him. Mm-hmm. We had a chronic dermatitis lady. We had a lady with bad lupus / fibromyalgia. People kind of just threw this label on her. No one really knew for sure what she had, but horrible pain and depression. A bad diabetic. He was on 3 or 4 oral medications. I told him he had to get on insulin. He refused. And I said, well, you're going to die then. Or you go see this guy in Amarillo that doesn't believe in diabetes. He doesn't believe in any disease. Anyways, that was a powerful one because most of my patients in post were diabetic or pre-diabetic. So when that guy came back off his medication and his A1C was normal, that was powerful. That's really what got me, was even if this worked in only 20% of diabetics, that's worth it. I mean, there's so many diabetics out there. When you're diabetic, you increase your risk of everything. Alzheimer's, cancer, heart attack, stroke, everything. So that was it for me. If I could help people reverse their diabetes instead of just manage it, I mean, that would help so many people. So anyway, started to learn this stuff. And I could see clearly that it wasn't going to work in a conventional clinic because it takes time.
Right.
1 to 2 hours
Right.
it takes to teach, to do a full comprehensive history exam and teach, because you've got to convince these patients that this is reversible and it is all about diet and lifestyle. So it takes time. So I could see clearly in my conventional clinic down in Post, where I had about 7 to 10, maybe 15 minutes for a visit, I couldn't do it. I tried to give them hour visits, and I told the administrative staff and the board that, you know, if everyone elects to do these hour-long visits, we're going to start losing money. And we were very successful financially because of 7-minute visits.
Right.
So, I mean, the writing was on the wall. I could basically choose to fall on my own sword, so to speak. I could commit to offering these 1-hour visits and helping people reverse their disease, and probably get asked to leave because we're going to start losing money. Or I could ignore all this I was learning and just keep doing the 7-minute visits and managing disease with medications, which that's an option. However, that option leads to not great outcomes, i.e. the American healthcare population statistics. Just go look at them. We're the worst, the sickest country in the world.
Yep.
Spend the most money, take
Right.
the most drugs, go to the doctor the most, get the worst outcomes.
Right.
So yeah, you can do the pharmaceutical-based symptomatic approach, but you need informed consent. And informed consent is, when I'm handing you this pill, you need to be informed that your outcomes are going to be a standard American outcome.
Right.
Decreased life expectancy and multiple complications, and you're going to spend a lot of money and go bankrupt.
Right.
I mean, that is our track record when
Right.
you treat a symptom. So anyways, I don't mean to go on a tangent there, but
So how many kids did you have at that time?
we had just had our 4th kid,
Right.
and that was about 2011. Got asked to leave the clinic because of, basically, in my opinion, the finances. We were going to start losing money, so I went downtown to the Farm Bureau office in Post, Texas, and rented a 1-room office down there for like $100 and bought a used office desk and chair and a laptop and started seeing patients.
Now tell me about the conversation that you and Jamie had, right? You were making good money there in Post with those 7-minute visits, and you're going to move into a situation there at the Farm Bureau where you're not going to be making near as much money. So I remember I went from making $300,000 a year as an ER doc to making $15,000 a year doing what you went to do. How did that conversation go over?
Jamie's a woman of faith,
Yeah.
so she took it pretty well. I could think she could see. She could see the hamster wheel I was on. She could, even though she didn't know there was really this other way to do medicine, just her inner spirit, she knew that God was leading us down this path. I was more the one freaking out. We got 4 kids, we've got a mortgage, we've got bills. I mean, when you're living a lifestyle up here and you maybe overextend yourself, because I'm about to get a good bonus check next month for all these things I did last month. And so I was a little bit concerned.
But do you remember what I told you?
Something along the lines of, don't worry, you'll be busier than you know what to do.
Right.
Know what to do with, because they're sick people, and as long as they're sick people and outcomes are poor in a conventional allopathic model, they'll find you.
Yeah.
And it was true. I was in the back of a Farm Bureau office with no website, no advertising, and no game plan, except I knew the truth of how to treat these folks, and they just started coming. And one would get better, and they'd go tell 10 more, and word of mouth, and it just grew and grew and grew, and kept growing and kept growing.
Right.
So we moved out of that Farm Bureau office, moved to Lubbock. There's a company here that believed in wellness, not just sick care, but well care. So they housed us, built a clinic there on site at the manufacturing company's office. We outgrew that, so they remodeled and moved us to another office there, and we outgrew that. So 3 remodels there, and growth and growing pains. You know, at one point I thought, I just need to hire every nurse prac and PA that walks in the door, because we have a waiting list. There's so many sick people. I have a burden for these sick folks, And you got to have the right nurse prac, the right PA, the right employees in general.
Right.
I mean, they've got to represent you accurately and have to be able to walk with these patients. These patients come sick, and not only physically sick, they've been run over emotionally, psychologically. I mean, they're hurt, and they're sick. And so it takes the right team, takes the right people around you. So I think we've kind of worked through some of those growing pains, continued to grow, and really wanted to start emphasizing more the diet lifestyle even more. I mean, we emphasize that the whole time.
Yes.
But there's a temptation as a doctor to micromanage and manipulate physiology, even integratively. You can get in there and use 10 different supplements and all these IVs and cool things, and we still do those. I'm not saying you never do them, like lasers and all these cool things. But if you only do that, your outcomes are still going to be not as optimal as they could be.
Right.
So I call that the green version of pharmaceutical medicine.
Exactly. Yeah.
And so we were doing some of that and working through different protocols and kind of cherry picking what we felt like were some of the better integrative protocols. But at the core, we wanted to continue to really emphasize the kitchen, food is your medicine, teach people how to cook, offer cooking classes. We needed a demonstration kitchen. We wanted to have an environment that invoked peace. I mean, stress is a killer. It kills your immune system. It kills your hormones. It kills your GI, your stomach acid. I mean, all this stuff that we're trying to build back up.
Right.
You can do all these things perfect, but stress will blow it all out.
Right.
So we wanted a place that invoked peace, and the kitchen that could bring the nutrition component. And we found this building in downtown Lubbock, Texas, and the video won't do it justice probably, but it's got this courtyard. We can maybe even walk out on the courtyard, which we're still in renovation mode, but we love it. Maybe she'll walk out.
Hey, Ben.
Oak trees and live oaks and a waterfall over there.
Right. And you were saying you're going to start planting food out here.
We'll plant vegetables and other ornamentals too, but the plan is to grow our food, and then we'll show you the kitchen in a minute, but juice it, smoothies, cook it, ferment it, really teach people to getting back to be the way your great grandparents cooked. They grew their own food, they picked it vine ripened, and then they went and ate it, or fermented it, or cured it with salt, real salt.
Right.
So really just getting back to the traditions of our ancestors, not only eating, but slowing down.
Right.
Saying no to all the things of, not all, but a lot of these extra things that we think we have to fill our life with.
Right.
And they're good, usually, mostly good things, but it's too much. And we're too full of stuff.
Right.
And that's part of the courtyard, is come and unplug and sit down, drink a juice, listen to the birds chirping, and take a deep breath and just chill out a little bit.
I know most people are thinking that Lubbock, Texas is the place to make that happen.
We thought about the hill country, we thought about Taos, we thought about the Caribbean, but God put us in Lubbock, Texas for a reason.
Right.
He hasn't released me from Lubbock, Texas, and it's a great town, great people. The downtown's about to be rejuvenated, I think. I'm a little biased, but I think this is the best office in downtown.
My vision, right, is to make the Panhandle of Texas the cure capital of the world.
It can be.
Yeah.
But it takes all of us getting on board, getting educated, renewing the mind, and it's going to take all these farmers regenerating the soil, bringing the microbes back to the soil, so we can get the minerals back in our food, and growing good food and stewarding your health in a more peaceful way.
Right. And we know that that's the foundation of things. You alluded to some of the augmentative therapies that you have also. So tell us about some of the ancillary therapies that you provide that will help people do what I call capping the well, right? So you've got to kind of cap the well and get the oil from spewing out before you start tackling the forest fire or the oil fire.
Yeah, and we meet people where they're at. People walk in the door sicker than dogs, super inflamed, super symptomatic. And so if there's something we can offer that'll help tap down these symptoms quickly or more quickly, we want to do that. That's not the ultimate answer, though. So we have lots of different IVs.
Right.
The kind of traditional, just vitamin and mineral drips. Myers cocktail is kind of a detox vitamin drip. We've got ozone and UV light therapies that really drop inflammation and boost mitochondrial output of energy. So every cell's got to make energy,
Right.
and these IVs can help boost that production temporarily. We've got a machine called biofusion that basically it vortexes light energy and creates a magnetic field that causes your sodium and chloride ions to vibrate in your collagen, and it tightens collagen up.
Right.
And it was originally approved by the FDA for skin and wound closure.
Right.
For non-healing wounds, we found that it really helps cartilage, tendons, ligaments. So people that are hurting in their joints, the biofusion machine is real popular. Recently, we've added another IV, ketamine. Some studies came out recently out of the NIH and some other institutions of great reputation, that ketamine, which is an old drug for anesthesia purposes, but if you do small dose, sub-anesthesia doses, you can get tremendous benefits for depression and anxiety, these brain symptoms of inflammation. And so we've been doing that with remarkable results.
So relate some of the outcomes that you've had treating depression with IV ketamine.
So the studies were done on patients that were basically resistant to therapies, meaning they'd been on Prozac, Wellbutrin, Lexapro, Zoloft, multiple meds. They've done counseling. They've done all these different treatment modalities, and they failed. So these studies were done on the worst of the worst, and they were getting 70 and 80% outcome rates, meaning symptoms resolved and stayed resolved, which is unheard of outcomes for depression and anxiety for any therapy. Well, that's exactly what we've seen. We've done 8 or 9 patients probably now, worst of the worst, suicidal, won't get out of bed, have been depressed for 20 years. Bad,
Yeah.
really, really bad, and amazing.
Yeah.
I've never seen a therapy like this. Literally hop up and skip out of here with a smile on their face. It's just,
and
it's
the reason
unbelievable.
that I started advancing this information to you guys is, like I said, I saw that documentary. It wasn't a documentary. It was just somebody interviewing this guy that was doing ketamine, and I saw that rapid relief, and I knew that was not it was not caused by the mechanism that they were saying that it was caused by. I said, this has to be an antimicrobial effect. It's just happening too quick. And researched it and found out that it's because the ketamine is an actual antifungal, right? And it's an antifungal that crosses the blood-brain barrier. And we know now from the psychiatric literature that depression, schizophrenia, so many of these things are Alzheimer's, autism are underpinned by inflammation in the brain. So we're basically, it's like treating strep throat, or a bladder infection, but with the right antimicrobial. So this, if we broaden our thinking some, right, and start to extrapolate, this ketamine IV is going to work for things a lot more than just depression.
Right.
Yeah.
We're looking at studies now, ALS, schizophrenia, Parkinson's, a number of different neurological disorders, basically.
Yeah.
So it'll be interesting to see what the future holds from that standpoint. But we always tell patients, these IVs can be a lifeline, or they can be almost a miracle cure. But the things that allowed, the internal terrain that allowed these critters to overgrow or these toxins to build up in you, ultimately you've got to get the terrain right.
Right.
And that's thus the kitchen.
Right.
You got to eat right. You got to bring your stress down. You got to move. You got to hydrate appropriately. So it's the very, very basics.
Yes.
And if someone's not super symptomatic or suffering horribly, then we just want to focus on that. Bypass the IV room. Don't even go in the IV room.
Right.
Go straight to the kitchen.
Right.
We're excited to be able to offer these therapies, but we always want to tell patients that is not the end game. That's not the goal. We don't want to sit here and, we keep our prices very reasonable on purpose, but if we were money driven, we'd just have you coming back for IVs
all the time. Exactly. And I've been in clinics like that.
Right. And our goal is to have those IV chairs empty, actually. And our goal is actually, like Roby said, for you to not come see us. Come once a year, check off all the boxes that you're symptom free, your labs look good, see you later. you shouldn't be at the doctor's office.
Right.
Just like your car should not be in the shop all the time.
All the time.
Your car should run beautifully forever as long as you maintain it and do what the owner, the guy that built the car.
Intelligent design.
There you go.
Yeah.
So, yeah, we'd love to see you if you need a doctor. And the Latin root of physician is teacher, so what you really need is a teacher. And then you need some coaches and some support to walk you through these things of diet and lifestyle changes. But our goal is to help people get well and then go through that gate out of this courtyard and go away. Go
Now,
be who God made you to be.
the model that you have here as far as seeing patients is a different model than people are used to going to see their family practitioner or pediatrician, internal medicine doctor. Talk about the structure that you have for integrating patients into the practice.
Yeah. So all new patients will fill out new patient paperwork online, kind of like you're used to. And then you'll have an initial visit. I'm doing some of those, but I can't do them all. So the nurse pracs and I do the initial visits. That's usually a 2-hour visit. And then you do 1-hour follow-ups. It's a membership base though. So you do an initial fee to sign up, and then you do a monthly membership payment, $65 a month. Your follow-ups, so that we really want you to do, are with the wellness navigators in our kitchen. So I'm putting my resources into hiring more and more wellness navigators who will walk you through. If they need to take you to the grocery store or sit down in the kitchen and show you how to boil an egg, some of our patients don't even know how to boil an egg, but to walk with you. Those follow-ups are included. They're free. They're as much as you want. You can text them, email them, FaceTime them, come face-to-face. So that's what we're really stressing, is follow-up with wellness navigators. Of course, you need medical follow-up too, so you'll come for those. There is a slight charge for those follow-ups. But the goal is you need your medical practitioner less and less, and eventually none.
Right.
And you stay a part of the community, the healthy community, and you stay educated, you stay supported, you stay up to date on the latest stuff that we're doing and learning. And we get enough of this community built up, you'll have a ripple effect throughout all your spheres of influence. So that's the real goal, is to make an impact all through West Texas with our members getting out there and teaching and helping and supporting their friends and family.
Right.
We can't see everybody. We don't need to see everybody.
Right.
But if you've got a lot of medical things going on, we'd be happy to see you and help you walk through those with the goal of getting you symptom-free
Right.
and disease-free.
So I think our index places for health need to be our schools, our churches, and workplaces, right?
Yes.
People like yourself and I go in and teach teachers, how to be healthy, teach first responders how to be healthy, teach the mayor, these other people, then that trickles down, to our most important resource, which is our children, right?
Yeah.
I mean, we're destroying them. And like you said, we have the highest infant mortality rate in the Western world.
And the highest disease rate.
Right.
I mean, 46% of kids have a chronic disease now.
Right.
It's crazy.
Right.
Don't get me started on that. But I'm with you. I feel for these kids.
Yeah.
And it's really sad. And it almost will bring you to tears when you just look at kids and the diseases they're battling. But you're right. For the first responders, I interviewed a former City of Lubbock fireman.
Right.
He's retired. And with the retirement plan, he gets Medicare and a supplement or something. And he gets a card. I think $150 a month or something on this card. And the folks from the insurance company called him from the city to say, "Did you get your card? Because we've noticed you're not using it." And he said, "Yeah, I've got my card, and no, I'm not using it. I don't go to the doctor anymore. I go to Veritas. I learned how to get healthy, get off my insulin pump, and not need a doctor." And I thought that's perfect. I mean, that's a beautiful testimony from a financial standpoint.
Right.
And governments will listen to that. The city will listen to that.
Right.
This guy's not using his card.
Right.
What if every city employee learned the truth, changed their diet and lifestyle, got the support, got educated, got well?
Right.
Then we don't need that card.
Exactly.
And we
Just
turn around and
think of
use
the
that
money, right,
Yeah.
that the city would save if they sent everybody to Veritas, right?
And then you take the money that you're saving there
Yeah.
and turn around and use it in the school lunchrooms,
Right.
and start feeding these
Feeding the kids, growing
quality,
gardens in the
real food.
schools, and yeah. And when you start to do that, and of course we saw this in Guthrie, right? When the principal or the Nelson Coulter, the superintendent there, came to you and found out about he helped his own health with nutrition. And then he implemented that for the school system. I mean, decreases, in sickness, of course. That 1 year, there was like 30% absenteeism, across the nation, right? They had zero, right? And reductions in the prescription medicine and absenteeism, and just improved all the way around, right? In the students. So.
Yeah, it'd be incredible. The body's resilient. When you can just give it what it needs, it'll function. And these kids can turn it around if we would just give them what they need.
Yeah.
And the school lunchroom is where it could start.
Awesome. Well, we're going to get you a class 4 laser in there also, and educate you guys on how to get rid of a lot of this chronic pain and some other things, that this laser does, which is just phenomenal, right? I showed you before and after pictures. But as always, I'm a phone call away, and here to help anything. And I will continue to kind of be the tip of the spear, right, out there doing and learning and researching, right, and then bringing back information that I think that you guys can use. So, but you are you're like a grown-up son for me, that has come in, and done some really remarkable stuff. I'm just super proud of you and what you're doing, and all the help that you're giving people. So it's really proud of you.
Thank you very much. Thanks for opening my eyes to this alternative to the disastrous U.S. healthcare system.
Right. Yeah. All right.